Painkillers are drugs that relieve aches and pains, such as headaches, sore muscles, arthritis, and other discomforts. Painkillers come in a wide variety, and each one has benefits and drawbacks. Both acute and chronic pain can be relieved by painkillers, including acetaminophen, nonsteroidal anti-inflammatories, and opioids. Here are the top 10 interesting facts about pain medicine that you need to know. But before we get started, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. Number 10. Opioid pain medications are usually most effective and most appropriate for short-term situations. Opioids are a class of narcotics that include heroin, synthetic opioid like fentanyl, and painkillers that may be lawfully obtained with a prescription, including oxycodone, hydrocodone, codeine, morphine, and many others. Opioid medicines work best in instances requiring short-term use, like surgery, fractured bones, and other acute ailments. Researchers claim that compared to other drugs, they are less effective at managing chronic pain. If you don't use them properly, they may have negative side effects. Opioid addiction typically has its roots in the prescription drug industry. In the brain, spinal cord, and other parts of the body, opioid medications bind to opioid receptors and triggers chemical changes that lead to feelings of pleasure and pain relief. Number 9. Pain medicine can make people addicted to it. Painkillers are highly addictive, and even when used as prescribed by a doctor, physical tolerance and dependency can arise. Some people can get dependent on drugs in as little as 2 or 3 weeks. A person is more prone to use larger doses of painkillers if they develop an addiction and a tolerance to them. Large doses can cause blood pressure to drop, heart rate to slow down, and breathing to become depressed. These harmful impacts may lead to loss of consciousness or even death. Number 8. Continued use of painkillers can lead to mental and physical deterioration. The continued use of pain medicine to the point of dependence can lead to issues with one's physical and mental health, strained relationships, loss of employment, and the possibility of overdosing and even passing away. Painkiller side effects are widely recognized. They have long-term effects on the physical and emotional health of users and affect almost every organ of the body. Some medications have the potential to cause sudden, potentially fatal complications, including internal bleeding, respiratory compromise, gastrointestinal issues, hormonal imbalances that result in long-lasting issues. Number 7. If the user stops taking the pain medicine, he or she may experience withdrawal symptoms. Painkiller withdrawal symptoms, which include aches, pains, tiredness, and nausea, can occur when a person stops using painkillers after dependency has developed. The opium poppy is the natural source of the opioids morphine and codeine. They bind to the opioid receptor that cause release of dopamine that triggers a surge of pleasure and relieves anxiety. When someone uses opioids for a prolonged period of time, cessation of opioids may result in opioid withdrawal symptoms. Although they are typically not life-threatening, this can be extremely stressful and unpleasant. Within 24 hours of taking the last dose of the drug, withdrawal symptoms can start to appear. They can surprisingly last a week or longer. Number 6. A person can become addicted to pain medicine for emotional, developmental, and environmental reasons. The likelihood of developing a painkiller addiction is influenced by a person's genetic makeup, as well as psychological, developmental, and environmental factors. The environment a person grows up in greatly influences their ability to get addicted, from social media and culture to peer pressure and familial interactions. Fortunately, several treatment approaches can assist you in identifying the root cause of your substance abuse and ending the vicious cycle of addiction. A phrase used to characterize the emotional or mental aspects of drug use disorder is psychological dependence, which includes symptoms like intense desires for the substance, troubled behavior, or difficulty focusing on anything else. Number 5. combining pain medicine with alcohol is dangerous and can lead to death. It is extremely risky to mix both narcotics with alcohol because it can cause respiratory depression from an overdose and lead to a trip to the ER. The harmful effects of the two substances are magnified when alcohol and painkillers are combined. Opioids can slow breathing by depressing the central nervous system, much like alcohol does. The combination can lead to harmful adverse effects such as breathing difficulties, lower blood oxygen levels, unconsciousness, and even death. Number 4. Pain medicine can worsen sleep apnea symptoms. People who have sleep apnea should inform their doctor because the drugs can worsen or even cause the condition to be fatal. Muscle relaxants and medicines, particularly opioids, can relax the oral airway musculature, exacerbating sleep apnea. Since drugs in the opioid class have the potential to inhibit breathing, this can cause breathing issues while asleep. So it is very important to let your doctor know if you have sleep apnea before taking any opioids. Number 3. Using leftover pain medicine can be dangerous. In general, painkillers are safe when used as recommended. However, using excessive amounts of these medications might cause kidney injury, stomach bleeding, and liver damage. Never hold on to unneeded prescriptions. The painkiller may have caused you to develop a high tolerance when you were taking the prescribed opioid regularly for an injury. You risk accidentally overdosing if you take one of those leftover medications later for a pulled muscle or a headache because your body no longer has the same tolerance. Number 2. Withdrawal from painkillers can be uncomfortable and dangerous if not done under medical supervision. Painkiller withdrawal is painful and risky if not done under medical supervision. Symptoms of opioid withdrawal include watery eyes, runny nose, muscle aches, diarrhea, vomiting, insomnia, fevers, and sweating. Interestingly, sensitivity to light and yawning can also be present in opioid withdrawal. Because of how unpleasant the withdrawal symptoms are, many people revert back to taking opioids. So it is very important to seek medical help and advice when trying to taper off opioids. Number 1. Many people who become addicted to legally prescribed painkillers can be prone to using drugs when they can't get pain medicines. When they can no longer get their prescription filled, many people who grow dependent on opioids that are legally prescribed choose to purchase drugs off the street. This is risky since the buyer can receive something that is tainted with another drug or that is too potent for them to handle. The parties to these deals frequently wind up in jail or a hospital room. Additionally, abusing opioids can weaken immune systems and cause side effects from neuroexcitation. This makes a person more vulnerable to infections, seizures, psychotic behavior, and dangerous cardiovascular disorders like heart attacks. Opioids can be a powerful tool to help with pain, but make sure to use it the right way under medical guidance to stay safe and healthy. So guys, that was it for this video. What did you think about our video? Let us know in the comments section below. If you are new to our channel, be sure to subscribe and ring that notification bell to get notified about our latest videos to learn more about the world of pain, rehabilitation, and regenerative medicine. Thanks for watching.